Good afternoon, everyone. Kevin Henderson, Grayson County Judge Executive. We just wanted to come to you this afternoon to update you what's going on in Grayson County with COVID-19, what some of the other leadership of Grayson County is doing with the school system, with the hospital, with the health department, and we want to just keep you updated. We're going to try to do these every week. If things change, we might try to do them on a daily basis if things start changing rapidly. So first, I would like to introduce Josh Embry with the Grayson County Health Department to go over some information with you with what's going on with the health department. And then we've got a couple other folks from the health department that's going to speak as well. And we've also got Wayne Meriwether here with Twin Lakes Regional Medical Center to tell you some changes that's going on there. We also got Superintendent Doug Robinson here to speak with you as well. So first up, I'd like to introduce Josh Embry with Grayson County Health Department.
Good afternoon, everyone. Today has been a very productive day at the health department. We have received several test results back, and Angee, nursing supervisor at the health department, will talk more about that when she comes up to speak. I know we're all anxious to know what the most recent test results say, and so we have some of that information for you. I know the community has been waiting in anticipation for these results, like I just said. The issue is with some of the commercial labs, they're running to about 7 to 9 days out in testing. It's kind of a good thing because that means more people are getting testing, so it's taking more time. But just be assured that we've anticipated these results as well. So I would like to thank the doctor's offices, the clinics, the labs for making sure that we are notified of these results as they become available. Collaboration is one of the most important things in a pandemic, along with communication, and we are seeing both in this county. Rest assured, going forward, we will continue to promote working together with our community partners. The hospital, EMS, nursing homes, county government, home health agencies, doctor's offices, clinics, food pantry, and schools, just to name a few, all encompass the community response and efforts that we have seen working to reduce the harm of this pandemic. As many of you know, the President of the United States extended the social isolation measures put into place until the end of April 2020. The federal government believes that these next 2 weeks will be critical. The need for strong, consistent response is needed. However, the community needs to understand that Grayson County has been working since January getting ready for this type of response. This isn't something we've just jumped into. We have been actively preparing residents for these difficult weeks ahead for some time. With that being said, we are still in this marathon together. Understand that we at the health department are working side by side with county officials, including Judge Executive Kevin Henderson. We're working with businesses like Walmart, IGA, Save-A-Lot, just to name some, as well as individuals to ensure the best mitigation and response. As the President has noted, there are better days ahead, and I truly believe that. The Grayson County Health Department has served you in good times. We've served you in bad times, such as H1N1 and the Hep A outbreak. This is just another opportunity that we have gladly embraced to continue to serve you. Just an overall update of what's going on at the health department in response to President Trump's extension of social distancing measures, as well as the governor's requirements. We have canceled all group support meetings and trainings at the department for the month of April. Our temporary hours will remain in effect. Additionally, our clinic is operating with reduced services, and our lobby will remain closed to the public. For emergency appointments, call 270-259-3141, and we will evaluate the situation around the 1st of May. For questions related to the virus, call the Health Department hotline at 270-899-0467. For environmental questions, call 270-259-8046. With this being said, I'll now give the microphone back to the judge. Any questions?
Sam, you got any questions on here? Nothing? Nothing? Okay.
All right, thank you so much.
And Josh, he may went over it, but I want to also emphasize to everyone to be sure if you feel sick, please call your local healthcare provider. Call them on the phone first and let them know that you're feeling ill and you might have a fever or cough or what have you. Next, we have with the health department, we also want to go over some numbers with you, is Angee McCreery. She is with the Grayson County Health Department. So next up, we've got Angee.
Thank you, Judge. So this is the most current information we have at the time of this press release. We have tested 62 people in the county for COVID-19. We have had 32 negative results. There are 28 still pending, and we still just have 2 positive cases. Those 2 patients are still at home and are recovering. We do anticipate seeing more positive in the coming days and weeks. If this happens, don't panic. It doesn't mean anything's any different that day than it was the day before. We're just doing more testing, so we're going to get more positives. I know a lot of you are doing your part and taking this seriously, and thank you. But for the ones of you that aren't, I can't stress enough how important it is that you do what we're asking you to do. It's going to take the best of all of us to get through to the other side of this, but we will. Are there any questions?
Questions? Anyone?
Thank you.
All right, thank you, Angee. And everyone needs to also keep in mind, treat everyone as if as they have the virus, and let's keep doing the social distancing, and hopefully our numbers will stay low, because in the end of the day, that's what we're all looking for, is a whole lot less cases than they have in other parts of the country. So next up, there's been some changes with the Grayson County school system, and we want to let Superintendent Doug Robinson come up and say a few words and let you know what's going on with the school system.
Thank you, Judge Henderson. Let me piggyback off of what Mr. Embry just mentioned there. We truly are GC connected. Super proud to be part of the collaborations going on with everybody in our community to help everyone. Just a couple of updates within the school system. We had all state superintendents had a conference call with Governor Beshear today, and he's asked us to continue no face-to-face classes through May 1st. So that's a different date for us. So we will be rolling out, we have been rolling out our NTI, our continued packets and online work through May 1st. We were kind of anticipating that, but today and tomorrow we'll be getting that work out as well. With spring break coming up, I would like to tell everybody, just take a deep breath and relax. It's been stressful for everybody that's home doing all their work. I made a comment earlier today that, about second grade, I had to stop helping my kids with their math because it was taught a different way. So I know it's stressful for all the parents and grandparents and guardians at home with all that. So we're doing spring break next week, and then we'll have 3 more weeks of the NTI and the school work. One of the changes that we're going to be having next week related to our food service is that we will be delivering routes on Monday and Thursday of next week, and that's a different change because of spring break. And to be honest with you, we've had, it's been a struggle just keeping our food supply coming into the school system, so we're able to provide those, and our food service team has done a wonderful job. I'm super proud of all of our ladies in that department. Our transportation department and other people have really rolled out that program, and we're right now feeding 2,000 meals a day on average. So that's the update and the changes from the school system. Any questions? All right, thank you for the opportunity, Judge Henderson.
Thank you, Doug. I appreciate that. A lot of changes going on here in the county. We just, like I said, we want to try to keep everyone updated with everything that's going on. Next, we have Wayne Meriwether with Twin Lakes Regional Medical Center. There's been quite a few changes that's going on over there. We've been working with them and Kerry Sims and Wayne through emergency management here in the county. So we want him to address, let him tell you all what's going on with Twin Lakes Regional Medical Center and all the changes. Wayne?
Thank you, Judge. Good afternoon, everyone. Let's start out with some uplifting news. We really had an outpouring of the community wanting to help the hospital and donate their time and efforts. And some of the ways that has happened, Bell Cheese and Future Designs has donated N95 masks. And let me tell you, N95 masks are critical to protect our staff. Boundary Oaks Distillery has converted over to be able to produce hand sanitizers, hand sanitizing solution, and they've donated some of that to us. Fastenal and Extreme Sports has donated eye protection to us, Walmart sanitizing wipes, and then probably what I'm most excited about are those masks that I talked about last time. I set a goal of I'd like to have community volunteers produce 800 masks, and we're up to about 600, so we're getting there and getting there rapidly. My goodness, we've had a number of folks do that: Dolores Miller, Joni Bowen, Jackie Glasscock, Rita Hazard, Bonnie Osborne, Gay Loren, Pat Murphy, Ashley Patterson, friends of Dr. Jenkins, friends of Dr. Green, and I'm sure there's others I'm leaving out. But I want to thank all of you for those efforts. And we've even had some folks make cash donations, and we'll gladly accept those and appreciate that. Another bit of really exciting news, I think. The American Red Cross held an emergency blood drive here that we helped sponsor last Thursday. And when I went down and talked to them at the end of the drive, they had received 50 units of blood. And why is that so important? As of last Thursday, there had been 7,000 blood drives canceled across this country, and that equates to 200,000 units of blood. So they actually couldn't accept all the folks that were wanting to donate that particular day. And we have another blood drive scheduled for April the 10th. Remember that day. And if you can donate, come out to the Center on Main and do that. Some of the changes that we've incorporated at the hospital since last week. You can, as I said last week, you can still contact your family physician or orthopedics or whatever service that might be, but that's going to be through a telemed method. So what is telemed? Well, instead of a face-to-face meeting with your physician, that's going to be through the telephone or through your computer. We've implemented that as of last week in most of our offices. Another thing that is a change, and that's a drive-through testing clinic. We started that yesterday, but now don't just show up and expect to be tested for COVID-19, because it's not going to happen that way. If you're experiencing a fever, high fever, a cough, or having difficulty breathing, you call your family physician. They will screen you over the phone, and they will instruct you to come to the end of the K. Bland building, and you'll be met there by a nurse practitioner that will test you. Now, if you don't have a family physician, go to our website, tlrmc.com, and you can look up any physician's phone number and call them, and they will instruct you, screen you over the phone, instruct you how to get tested through that drive-through. Now, we've all heard about the difficulty in getting tests, the delays, and how long it's taking. We've had some tests out now on day 10 that we're still waiting on. We've gotten some a little bit quicker than that. Well, we're looking at other labs, and the labs we are using are opening up other testing sites. So we hope that time frame will shorten. Abbott Lab came out with a new test last week that can be, you can get results in 5 to 10 minutes. Now, fortunately, we have the lab equipment to be able to read those tests. Unfortunately, those tests are currently going to the places where they are needed more, like the hot spots you're hearing about. But we heard today that we may be able to get an allocation of those tests. And if that's the case, we'll be able to do the testing right here at Twin Lakes. Another encouraging aspect in testing, I had a call with Owensboro Health in Owensboro this week. They said by the end of the week they would have a testing method set up at their hospital, and we could utilize that and probably get next day results. So faster testing is on the horizon. Next, I want to talk about our surge plan. You know, we've been meeting every day for I don't know how many weeks now, preparing for the coronavirus and handling COVID-19 patients. And as we found, especially within this last week, you know, we've talked about setting up alternate care sites where we could expand the number of patients we could handle at Twin Lakes. And we have a system in place to do that. The problem is the ventilators. We can handle a COVID-19 patient up until the point where they have to be put on a ventilator, have to be intubated and put on a ventilator. Now, we have 6 ventilators. We can convert some of our anesthesia machines to ventilators, and we can handle a number of those. But we had a conversation with a respiratory therapist in Michigan that's handling these patients now in her facility, and she told us exactly how they're treating those with on the vents. And we only have a couple of ventilators that will do what needs to be done to give COVID-19 patients their best chance of survival. So we've been in conversations not only with Hardin Memorial but also Owensboro Health about setting their hospitals up as critical care hospitals where they can take all respiratory and COVID patients and treat those. I think Hardin Memorial is probably a couple of weeks away from being able to do that. Owensboro Health has their surge plan ready to go. We had a conference call with them earlier in the week. They're 475 beds. They can gear up to 600 beds. They have 100 ventilators, 72 negative pressure rooms, and those are the type of rooms that you want to have in place to handle these patients. So they are much more equipped with supplies and equipment and facilities to handle COVID-19 patients. We want to give folks in our community the best chance of survival possible. So if a patient comes into Twin Lakes Regional Medical Center and they progress to the point where they need to be ventilated, we are going to transport them probably first to Owensboro Health and then possibly in the future to Hardin Memorial. Owensboro Health is ready to go now. I asked them that question, and they said they're ready to accept patients. And they've probably treated more COVID-19 patients than any hospital in the state. So they're prepared. With that, I'll ask if there are any questions.
Thanks, Sam. Anybody?
All right, thank you.
Thank you, Wayne. Wayne, if someone's got a question, what would be a good number for them to call and who to get in contact with at the hospital?
They can just call the main number and
259-9400.
and ask to be transferred to administration, probably the best way.
Yeah, just call, if you have any questions in reference to the hospital, call 259-9400 and ask to be transferred to administration. So if you got any questions, just feel free to call them. All right, thank you, Wayne, I appreciate it. All right, just going over a few things. County Clerk's Office, and we've had a few calls about tags, vehicle tags. There is a 90-day extension, so if you can't get in or mail in or do web, get on the web and do it, you've got a 90-day extension at this point. The office is closed to public traffic, but the phone number is 270-259-3201, 259-3201. Sheriff's Office, Sheriff's going to talk here in just a little bit. Their phone number 259-3024. Someone will be back in that office on April the 6th, which is Monday, April the 6th. And the tax collection for property taxes has been extended until May the 15th, which Sheriff can go over that with you as well. Circuit Court Clerk's Office, 270-259-3040. There is a 90-day extension on your driver's license renewals. That's the Circuit Court Clerk's office. Stacy Blaine is the clerk there, and you can call that office at 259-3040. Grayson County Water District, I have got with Kevin Shaw. He wanted me to let folks know that they are open for business. Although they are very limited at the office, the front door is closed to the general public. Payments may be dropped off at the night deposit or through the drive-through window. Payments may be made online at GraysonCountyWater.com, www.graysonwater.com. Payments may be made by the phone at 1-844-517-9740. That's 844-517-9740. Payments be set up for auto draft through their payment system. You can also still use the United States Postal Service. Any of their services outside of the office have any fees associated with them. They have always come at no cost and will continue to come at no cost. Provisions have been made to make new application online through the website to keep the customers from needing to come into the office. And maybe most importantly, we ask the customers to be patient with us and help us with social distancing of the guys in the field. They are not being unfriendly with their customers, but they ask you to respect their space and the safety of them and everyone around them. So that's a statement from Grayson County Water District. Next, we have CATS Transportation is still active. You can give them a call if you need a ride somewhere for the seniors. Community Action, that number is 270-259-3500. Get with Tracy Dennison. I know they've got some people that's actually working at home now, so that number might roll over to someone that's working from home. So if they don't answer, try back. If you can't get in touch with anybody, call me here at my office and we'll get you in touch with somebody. That's 259-3500. Food Pantry, everything's going great at the Food Pantry. People we're sending food out every day. I've got some of our guys here at the office that's actually going out and helping out with that. 259-4000. There was some questions, right, about factories. Okay, what we need to do with the factories, guys, is I'll let you know. I'll tell you to call the HR department of all the factories. I'm not going to go through the entire list of what's operational and what's not operational. If you work there, you should know that you're not going to be going to work. They've probably explained to you that you're not going to be going. We've had a lot of people say, why the factory's still open? You need to call the HR department and find out, because they have called the state and evidently they have been listed as essential services. Well, some people might say, well, I don't know why they are essential services. Your HR department will answer that question for you. Just like Leggett and Platt, for instance, they make medical chairs and beds, I think, for customers. So, and some of the other factories here, you know, agriculture. Somebody said something about Campbell Hallsville. I know they've had a furlough, but they also they make agriculture goods for air compressors for farmers and stuff, and of course that's listed as essential services. So, but I'm not going to go into all of them, but please just call their HR department. Find out if you don't like the response. Call my office. We'll call somebody or give you a number to call to find out why they are open. Next, we have 6 county employees. Last time we met, we had 6 county employees that we sent home for quarantine just for safe measures. They're all doing fine. Everybody's doing good. They'll be back to work on Monday, April the 6th. And people has asked about mask that we have here at the county. We've got Fair Share Manufacturing here in Litchfield is actually making masks. We've had a lot of people call and some businesses and stuff. And some of the masks that we have here, we cannot give out anymore because we're saving them for the medical personnel here in the county. And I'll go over our PPE that we have on hand here in the county here in a second. But they are making them. Number over there is 270-259-3850. 270-259-3850. You can talk to Laura, and she will be more than glad to help you get you some masks made and tell you what the cost is, and you can pick them up at 115 Sequoia Drive. That's right across from Farmer's Feed Mill is where that's actually at. All right, we've had a few people ask about where we stand as far as what do we have on hand here. Just to read through it quickly, and we want to try to get this done before the governor comes on here in a few minutes. N95 mask, this is what we have on hand, but is not including what the hospital and the local healthcare providers, the nurse practitioners, the urgent cares that we have here, fast pace, this is not including. This is what we have on hand for the county to help them out with if they run out. N95 mask, we have 1,750. Surgical mask, we have 39,700. Procedure mask, we have 3,500. Gloves, small gloves, we have 200. Medium-sized gloves, we have 2,500. Large size gloves, we have 9,100. Extra large gloves, we have 8,500. Surgical gowns, we have 0 at this time. Now there has been from Kentucky Department of Health has given us on surgical gowns, they've given us 30 extra large, 30 large, and we've distributed those to medical facilities here in the county. So we're back down to 0 on those, but we've got other shipments that'll be coming in. Surgical gown kits, we have 19 on hand. In large, extra large, we have 35. Double X, we have 16. Isolation gowns, we have 6 on hand. We've received 46 and gave 40 of those out to healthcare providers here. And like I said, we've got some more on the way also. Face shields, we've got 88 that is in stock at this time. We've handed out 35. And we've also got more coming. And from my understanding, ECTC has stepped up, and they are starting to make face masks, the plastic face masks for folks. So that's actually what we have on hand as far as PPE. So we're in pretty good shape considering our numbers right now, and that's why we continue to get more, because in case we do have a outbreak like some of the larger urban areas, we want to make sure that we're prepared and ready for that. The next thing I've got is we're having some issues, a lot of phone calls, folks. I mean a lot, about people coming into Nolan and Rough River Lake, and we're having some issues with that. And folks has come down. Quite honestly, I was down at the Nolan area and the Wax area day before yesterday, and I met 4 golf cart loads of children on golf carts and congregating together. Well, for one, to be on a golf cart on a county road is illegal in itself. So folks, we need to, we know everybody's got secondary homes down here, but we want to make sure that you're following the same guidelines down here that you do in an urban area, because I know we don't have the population is not as heavy here, but we don't want to end up having a problem. We want everyone to get out and have fun. It's a beautiful day today. The weekend's supposed to be beautiful, but we want to make sure that everyone is following the guidelines. So please do not come down here and think that it's a vacation, and because we've got people that is worried about what's going on here, and we don't want to add to their anxiety because they see a lot of folks out just actually not paying any attention to the guidelines. So with that being said, I'd like to give it to Jeremy Logsdon, our county attorney. We've had some questions about what we can do about this, and I want him to address that real quick. So without further ado, Jeremy Logsdon.
Good afternoon, everyone. I'm Jeremy Logsdon, the county attorney. I just want to first say that we are very pleased with the overall business compliance and overall individual isolation that has been going on here in the county. Very pleased. Concerning the gatherings that are taking place around the lakes that the judge just addressed, I've spoke with our sheriff, Norman Chaffins, today, and we believe, based on some guidance from the Attorney General's office, that we have the ability to try to combat this unnecessary gathering at certain points. Obviously, the lakes are important to us, and the people that come here are more than welcome to come here. If they own property or if they're renting property, if they come down here, they're more than welcome to stay, enjoy nature. We just ask that they separate from unnecessary groups. The KRS, the Kentucky Revised Statutes 525.060, it lists a charge that we're able to use in these situations. We believe that the protocol will go this way. If there's a group at the lake that is together and does not have a necessary reason to be together, then an officer, if called, will come out and warn that group to disperse. And that's allowed under the statutes. If they do not disperse at that time, or if it's found that they do come back together, at that point they can be cited, and most likely will be cited, under this KRS. And I will pursue this matter in our criminal courts. Now, as I said, we are overall very pleased with the compliance, so I don't want to be doom and gloom. I think that we see from our numbers that our county, the people of this county, are behaving wonderfully and are using common sense. With very few exceptions have we had to take action against those individuals or businesses that have not been using common sense. With that said, the last time that I spoke on here, there was a young lady who messaged me, and this is a little bit on the lighter side. But I got a message from a mother who said that her little girl, a 4-year-old, had enjoyed me speaking and had asked me to read her a bedtime story one night. Well, Miss Olivia Ray, when this is all over, I'll be happy to do that. Thank you.
All right, Jeremy, thank you. Next, I want to introduce Sheriff Norman Chaffins to try to go hand in hand with what the county attorney just let you know here. So, Sheriff Chaffins.
Just to reiterate what Jeremy was talking about, that's one thing about us. It's not going to change. We're still going to continue to enforce the laws. We have received many complaints about gatherings, especially at the lakes. And we just need to know that, folks, the more we travel, the more we congregate, the longer this is all going to last. So if we come down there, we ask you to disperse, then and you don't, then we're going to issue some citations to people. So, you know, please, let's not congregate. Even the governor has asked us not to cross, you know, county lines, not to travel. We can get through this a lot quicker if we do that. On another side, I want to share with you something that we're doing at the Sheriff's Office. We have teamed up with Midway Pharmacy at Caneyville, Litchfield, and Clarkson, and the Clarkson Drug Store there in Clarkson to do pharmacy deliveries for their patients. And that's something we're honored and excited to be able to do. The way that's going to work is if you have a prescription that you need to pick up, you let your pharmacist know that you would like it delivered. And if they don't have, if we're going to fill in for what the space that they need, and we're going to pick up some of their deliveries. Understand that you're going to have a law enforcement officer show up, may or may not be in a marked cruiser. We're going to have a law enforcement officer show up with your prescription. We will do those deliveries for you. We still are waiting a response from Walmart and Walgreens to see if they want to get on board with it as well. But right now, it's just Midway Pharmacy at Caneyville, Clarkson, and Litchfield, and the Clarkson Drug Store that are participating in this program. And we're, like I said, we're excited to be able to do that, and you just need to let your pharmacist know rather than you getting out. This comes in very handy if you have an elderly parent, if you're a family who maybe have some special needs kids, you don't want to get out, but you want to still need to get those prescriptions. You let your pharmacy know that you'd like for the sheriff's office to pick those up for you. Again, as the judge said, we are extending tax payments until May the 15th. We do have our ladies back in our office right now. We do ask that you don't travel unless you have to, but we will make available. If you want to call, we can have reports ready. We can bring reports to you, however we need to do that. And also to remind you to check on our elderly folks and our special needs families. We're still continuing that. We are seeing, we're starting to do a lot of welfare checks throughout the week, and we're glad we're able to do that. We'd ask that you continue to call those in if they need to. We can deliver medication and food to them as well. Our office, again, is still closed. The lobby is still closed, but we are still conducting business inside the office. Lastly, I want to share with you something that we haven't seen a lot of, but we're going to see it here in the next few days, and that's scams. We get numerous calls every week before this coronavirus hit about different scams that people are being subjected to. One of those is phishing scams, which is an email scam where someone claims to be from the CDC or the World Health Organization, and they're asking for donations, or they're trying to tag along with CDC saying to get information from you. Be very cautious, be very cognizant of that they're going to be sending you these emails over the next several weeks. And unfortunately, there are bad actors out there that want to do this to people. Social engineering scams where there are people setting up GoFundMe pages and things like that to ask for donations. Don't fall for that. And lastly, we're seeing people that are claiming to sell medical supplies, whether it be masks, gloves, things like that. And you place an order and you simply don't get the delivery, and they get your money. So be very, very careful and be very vigilant when it comes to these different scams that people are, these bad actors out there are trying to get on our folks. So with that said, I want to thank you all. As I said, as far as the sheriff's office is concerned, it's still business as usual. The only different thing that we're doing is we're closing our lobby to traffic. But as far as my deputies out there enforcing the law and doing what they need to do, we're still going to continue to do that because we're all in this together. Thank you, and I'm sure we'll be talking to you soon.
All right, thank you, Sheriff. Next, I know we've run a little bit long. We want to try to hurry up here because the governor's he started his press conference, and we want to see what his updates are. Just basically remember, treat everyone like they have the virus. If you treat everyone like they have it, you're going to be good on social distancing. Just remember that. I want to throw a shout out to Walmart, as they've done a great job here in the past few days in updating and their store and the aisles, and pay attention to what's going on there. I think they've closed down one entrance, so if you go out there, pay really close attention. Bunch of people gathered up in the mornings, folks. Stay in your vehicle. Don't get out. I mean, we don't need to be getting out and, standing in line with 60, 70 people. It's going to be a beautiful weekend, so it'd be good to stay at home, get outside. We had to close the parks because we had 40 or 50 people gathered up at the ball fields. I apologize for that, but we're just trying to watch out for everyone's safety. And in closing, I want to tell everybody, I'd said in the last press conference, that you will probably know someone that ends up with this virus. Well, it is true. I know someone that has this virus, and unfortunately, he is on a ventilator in Bowling Green, and he doesn't live in this county, but he's not in real good shape. But I got a text about an hour ago and to let us know that he is doing a whole lot better than he was this morning. But however, he is still on the vent. So, folks, this is real. This is not a joke. This person I'm talking about is in their mid-40s, male, and he's been a good friend. His family is great friends, and so I want to remember them in our thoughts and our prayers. So I want to thank you all for tuning in again. We'll try to update you if anything changes here. We'll definitely come back at you and let you know what's going on here in Grayson County. But thank you.